Hi, thank you. Thank you so much for this opportunity. Thank you, Assisi, for sponsoring. And I really want to thank you for your time, your compassion and your care of pets, because, you know, as much as we in the veterinary community like to think we're important, we're nothing without you. So you're the beginning and end of all of treating pain and treating pets. So thank you. It is a really great honor to be able to speak with you about detecting pain and just opening the conversation about pets and pain. This isn't something that is as frequently spoken of as pain in humans, and we'll talk about why. So one of the reasons is animals hide pain. They don't want you to know that they're in pain, so they spend their whole lives trying to avoid showing you that they're in pain. They still live by these wild instincts that they have and continue to have, even though we pretend they don't. They may sleep in our bed, they may eat off our dinner plates, they may even get in the tub with us every once in a while, but they're still wild animals. And that instinct has not gone away. It's all about survival of the fittest. And I think about, you know, those specials on the Serengeti from National Geographic that we all watch, and the gazelle at the back of the pack that may not be quite as fast as the rest of them winds up becoming the lion's lunch. And this is in them, and this doesn't go away regardless of how we treat them. The other thing about animals and pain is that they compensate for their pain. So because they don't want us to know, they just keep going and they hide it. So they won't necessarily hold up a leg that's hurting. They'll still place it. The only time they'll really hold it up is if it's too unbearable to even place. So when you start thinking about that and thinking about those concepts, it's really even harder to detect pain in animals. Again, by the time it's actually obvious to us and, you know, your dog is limping and you're calling the vet or, you know, making an appointment, that pain's been going on for quite a while. In humans, 30% in the US report chronic pain. And that's a pretty significant number, especially considering that these are only the humans reporting it. The beauty of humans is that they can report it, and they actually like to report it a lot of the time. You know, humans talk about their pain. Even if humans don't try to avoid talking about their pain, it gets recognized and picked up by other humans. You know, if you've ever had a migraine and somebody says, "What's wrong?" It's picked up whether you're talking about it or not. So we do, with animals, have to work around certain assumptions. And, you know, as a pet owner, I would always rather err on the side of pain. So we'll talk about that. But there's just some things we're going to have to assume without necessarily having proof of, especially when we're talking about cats. So what is pain? It's really any unpleasant sensation. Pain's usually broken down into two different categories when we're talking about it in a clinical setting. Acute pain is usually from trauma, injury, surgery, if a patient is potentially hit by a car or has had their cruciate ligament repaired. This is all acute pain. It comes on quickly, it goes away with healing, and once it's over, we don't worry about it. That's what makes acute pain easier to detect. Usually there's visual cues. So if they've had surgery, there's an incision and a really bad haircut. If they've been hit by a car, there's obviously trauma and blood associated with that. Acute is harder for them to hide. A fractured leg is harder to hide than an arthritic leg because it's acute. It happens all of a sudden. The other thing about acute pain is usually if it's treated appropriately with good analgesia, it goes away and it heals and it's gone. Chronic pain is much harder. Chronic pain lasts longer than 2 weeks. That's the typical definition. The other thing about chronic pain is it tends to be more internal than external. Not always, but it usually doesn't come with these obvious visual cues. So if you think about the difference between, you know, repaired surgical ligament in a knee and, you know, something like osteoarthritis, one is going to have obvious visual cues, the other one will not. Because it's chronic and it's been going on for a long time, these animals have time to compensate. So they have time to put more pressure on the other 3 legs that don't hurt, and therefore harder to even see it. It just takes longer. The other thing about chronic pain is the treatment for it needs to be long-term. With acute pain, the treatment usually ends when the injury ends. But when we're talking about chronic pain, this treatment needs to be long-term and a lot of times lifelong. So that kind of puts another wrench in our treatment of chronic pain, and we'll talk all about that. For most purposes today, we're going to really be focusing on chronic pain. That's where we really need you guys to advocate for them and to bring it to our attention, and we'll talk about that. Some misconceptions. So these are some things that we're going to kind of go over and squash over the next half hour. And these are misconceptions that still continue in veterinary medicine too. They're quite prevalent. If they're eating and wagging their tail, then they're fine. They're not in pain. And I'm going to tell you a couple cases where that's absolutely not the case. Even cats will eat when they're still in pain. Again, it goes back to that wild instinct. And with dogs, they're dogs. I mean, you know, it takes a lot for a dog not to eat. Only old dogs get arthritis. That's actually not the case. And we'll talk about some evidence that's come out against that. That's more of a human thing, is aging with arthritis than dogs. Research is coming out that it may be more of a cat thing as well, but we'll talk more about that. Only big dogs get arthritis. You only have to worry about German Shepherds and Labradors and the Pit Bull variety, which you can see I'm a little partial to. And that's not the case. Little dogs get arthritis absolutely just as much. It has nothing to do with the size of the dog. Cats don't get arthritis. A lot of people don't know this, and they do. They get a ton of arthritis, and we'll talk about that. My dog's old, he's just slowing down. That's actually not what dogs do. Dogs are dogs. They live for the moment. They live for the day. They don't necessarily slow down. And if they are slowing down, pain could certainly be one of the reasons that they are. It's amazing how treating pain really gives a dog, it takes years off a dog's life. My dog's just being stubborn. He doesn't want to go for a walk. You know, some dogs may be stubborn, but most of the time there's something going on, and it's always best to make sure that's not the case before assuming that they're stubborn. And I hear this all the time. I hear it at work. I hear it at home. I hear it everywhere. Cats are spiteful, and that's why, you know, maybe they urinate somewhere, and cats aren't spiteful. I'm not saying that as a cat person. I'm saying that as a veterinary person. They are not spiteful. They have very few ways of telling us things. So urine is one of their ways of communicating, and I'll talk more about that as well. A little bit about pets versus humans that, you know, I don't think we always think about, and it's really important and makes a big difference, is that we've talked about how pets hide pain. They're also nonverbal. I mean, it's similar to treating pain in infants. They can't really verbalize with us, and with humans, we have this great smiley face. It's called the Wong-Baker scale. And you may have seen it if you've ever been in the hospital or visited anyone in the hospital. It's hanging in every room. And if you're hospitalized, they'll ask you on a daily basis, you know, a couple times a day, tell me how much does it hurt, point to the face on the scale. And dogs and cats aren't so good at pointing. So we have to kind of point for them, and we'll talk about how we can do that. Pets also don't abuse pain medication like humans, so that's one area that we have the upper hand in them. At least I haven't seen it yet. Administering meds and treatment can be a problem in pets, and usually it's not in humans. So, you know, a lot of people can't get meds into their pets, and I am one of them. I have a cat with no teeth that I can't get a pill into to save my life. So if he needed pain meds, I would have to get creative, and I have, and there are creative ways. It's just a whole nother hurdle to kind of cross when we're talking about animals and pain. So why do we care so much about pain? Well, I mean, I'm sure everybody who's participating today has had some kind of pain at some point in their life. And what you know when you have pain is that it affects everything. If you have back pain, it doesn't just affect your back. It affects your level of anxiety, your stress. It affects your mood. It affects your relationships with other people. And it's the same with animals. It's going to give them anxiety and stress. You know, if we have back pain, we know we can take meds, maybe we can get surgery, maybe we can have injections and it'll improve. Animals don't even have that wherewithal to think about the ending of it all. Also, pain delays healing. It releases your own endogenous steroids, which actually can interfere with healing. And stress and anxiety do the same. So stress, anxiety, and pain will all make healing slower or not happen at all. It affects sleep. You know, if you have back pain, you're up all night tossing and turning because you just can't get comfortable, or it wakes you in the middle of the night. So therefore, it affects your quality of life, and it does with them as well. Everyday activities become painful, and you don't want to do them. And when I think of a dog or a cat, but both, they live in the moment. Like I said, they're not living for tomorrow. They're living for the hot dog or the catnip that's right in front of them right now. And they did a large study, and they found that humans actually fear pain more than death, which makes a lot of sense, and is why, one of the reasons why it's so important to identify and treat pain. So what causes chronic pain when we're talking about this? Well, really anything. One of the more kind of popular or prevalent things is osteoarthritis, which we're going to talk a lot about today. But other things that can cause chronic pain is cancer, severe dental disease. That won't stop them from eating either. So they will still eat with dental disease, hard food too. Declaw. More and more papers are coming out about how detrimental declaw can be to cats' pain levels, their physical health. And I'm going to show you a picture of a cat that didn't appreciate his as well. What I like to call weird cat stuff. Cats get these strange pain phenomenons that really nobody can explain. One's kind of a facial reaction where they paw at their face. They can get this kind of hyperalgesia where they'll attack themselves from pain. So that's the weird stuff that we don't even understand. Then when it comes to cats, we have to talk about urine and bladder. This is a huge source of pain and discomfort in cats. I'm going to talk a lot about it because I've experienced it in my cats. I've also asked a lot of humans about this, and this is one of these things that's common. So when it's common, we don't really think it hurts that bad. Animals with GI disease. We see animals with IBD, inflammatory bowel disease, or IBS, it's called in humans. Pancreatitis is incredibly painful, where the pancreas becomes inflamed. Chronic ear infections. Again, it's kind of every day we see these, but you remember when you've had an ear infection, it's one of the more painful experiences that you've gone through as well. Skin disease, these itchy dogs, that's pain, that's affecting quality of life. And then there's that spine and nerve pain, like animals that are predisposed to back injuries, dachshunds, corgis, dogs with long spines that are low to the ground. This is a cat, this is actually my cat, his name is Kevin, and he had a urinary obstruction. He's one of these cats that had this urinary obstruction, and it can be incredibly painful. He said so. So we need you, and this is why I really appreciate your time and Assisi's time, because none of this can happen without you. You can see that from the list and just from being at the vet yourself. And we can't pick them up and bring them in for you. And you're the ones who take care of them. We need you to bring them in. We need you to help report for them. Bring it to the veterinarian's attention. You are going to see subtle changes that are not going to be seen at the vet. It changes in their emotions as well that we'll talk about. When we start treatment for pain, we need you to monitor their progress to let us know, is this working? Is this not working? Do you need more? Do you need less? And in the clinic, you know, if any cat owner here knows what your cat does when they're in the clinic, and that is hide. They don't want to come out of the carrier. So asking a cat to walk across the room, maybe walk up steps, is a lot to ask of a cat. And it makes it really hard for us in the hospital or in the clinic to evaluate their joints, their pain, their walking. They'll also won't show you pain. They don't want us to see. And cats and dogs in the clinic have an adrenaline rush. I mean, I see it every day on triage, and everybody says it's like when you bring your car in, your car's making a noise, and you bring your car in and the car doesn't make the noise. You bring your dog in because it's, not using one of its back legs, and it waltzes right through the waiting room and walks just fine. That's adrenaline, and adrenaline is going to mask anything that you're seeing that we're not. There's also, a dog, a cat, that's going to distract everything. There's smells going on, there's noises, there's alcohol. So they're totally distracted on top of it. And there's just things we can't replicate in the clinic. So we really need you to help us. And also the other thing I always recommend, and I do myself, I did it a couple of weeks ago, is videotape it. I don't trust myself even when it comes to my dog, so I videotape everything and have a doctor look at it. So that's always a really great way to go. And with the cell phones, it's not a big deal anymore. And cats, I always say, because again, they're not going to walk across the floor in the treatment room, and nor should they. Cats have no place in the hospital, I always say. They don't like it there. So if we can keep them out of there, the better. Osteoarthritis. So this is kind of the main objective when we're talking about chronic pain. And like I said, it does affect quality of life. It affects ours, and therefore it affects theirs as well. The thing about osteoarthritis is you can't treat it and it'll go away. It's a lifelong chronic disease. We can make them feel better, but we cannot reverse that joint degeneration that's going on in these joints of these guys. We can help them lose weight, which will take weight off of the joint. We can help them get moving. We can implement a lot of therapies, but the truth of the matter is once it's there, it's not going anywhere. We can help them feel better, but it's not going to go away. I hate to harp on weight loss because we all do, but it is so important, especially when we're talking about osteoarthritis. And it breaks my heart when I see these obese dogs come in with, joint disease, because it's just the obesity is making the joint disease worse, which then makes the obesity worse. And we'll talk more about that. But it's not easy for a pet to lose weight. I think it's even harder for a cat personally, but it really is important. They actually did one study on preventing that just came out not too long ago on osteoarthritis in dogs. And what they found was there is one thing that helps prevent osteoarthritis in dogs, and that is keeping them lean. And they actually had evidence that showed that. So treatment needs to be ongoing because the disease is ongoing. So we need to keep treating them lifelong. And you've probably seen this in your cats and dogs. When they put on a little weight, they're a little slower. And then they start to lose a little weight and they become more active. So once you get the ball rolling, they will kind of keep it going for you. Osteoarthritis is not age-related in dogs. This is not an old dog disease. This is just a dog disease. Again, in humans, it tends to be more related to older age. In dogs, it's just related to being a dog. And it is not just big dogs. It's our Yorkies. It's our Chihuahuas as well. They have orthopedic problems, and orthopedic problems lead to osteoarthritis. One of the other things that will lead to joint issues and joint problems is an animal that's had a previous injury. So if they were hit by a car when they were younger and had a fracture in their, right hind leg, you can expect that right hind leg to have arthritic changes in it as they age. These guys that have this orthopedic diseases in these knees, these little guys with their knees, you can expect them to have arthritis later on from this knee injury. 40% of all dogs is about the number we're getting to. It was 20, but new information has bumped it up to 40% of all dogs have arthritic changes. So in my mind, I kind of assume all dogs have arthritis. I mean, period. Especially, when animals do start to age and they've had an injury. Puppies are really hard to detect pain in because they just compensate. They're puppies and they keep going. And their bodies kind of grow to compensate. So really hard to detect pain in puppies. There are certain breeds that are predisposed, like I said, the long dogs, the dachshunds and the corgis are predisposed to spinal issues. German Shepherds are predisposed to hip issues. So having a certain breed of dog can predispose them also to arthritis and arthritis pain. And like I said, previous injury. This dog is a three-legged dog. She was my dog. I have a three-legged dog thing. And she had arthritis. She was missing a right forelimb, and she had significant arthritis in her left forelimb, in her shoulder and elbow, because she was using it twice as much and putting twice as much weight on it. So even three-legged dogs, you've removed the damaged leg, they're still going to have arthritis and arthritic problems from not having the leg. So like I said, osteoarthritis not only exists in the cat, but it's incredibly prevalent. They're seeing a huge percentage of radiographic, so they take x-rays of these cats and see damage in their joints on x-ray. When they did large-scale studies and x-rayed cats that were coming into the clinic for any reason, not for pain or lame or limping, 45% of the cats that showed x-ray changes in their joints showed signs of pain. So to me, that means that, you know, we detected pain in 45% of these cats, which probably means it's a lot higher. And then 90% showed damage. So we're only seeing half of pain in half of the cats. So again, imagine how many cats are actually painful. This is a cat that had a declaw at some point in her life, and because it was painful for her to walk on her toes, she's compensated, and now you can kind of see she walks flat on her hocks down in the front end. Most of your cats walk kind of more up on their toes. In cats, it tends to be more likely their shoulders, hips, and spines than dogs. And the other thing about cats, because they like to make everything harder, which is why we love them, is that they usually will have arthritis and arthritic changes in both sides of the hips, of the shoulders, of the whatever. So they aren't lame or aren't limping. Lame is just another word we use for limping. So they'll be walking perfectly normal. So they won't even show you that. And then cats have fewer cues to show us. So what are we looking for? Now we talked about how hard it is. What actually are we looking for? And the moral of the story is anything, unfortunately. I think any change in any of our pets needs to be evaluated for pain as well as, you know, other disease. And like I said, nothing excludes pain. You know, I have a pit bull type dog, and he will wag his tail, eat, and be happy if he had a limb hanging off. And I work with the Trenton Animal Control as well, and they bring in these dogs that horrible injuries that are eating snacks and wagging their tails and giving us kisses. So that's really, they're dogs. That's not a good evaluation anymore. These changes can be physical or emotional, and the signs may be subtle because they are gradual. This is actually my cat Kevin again, and you know, he's eating. I don't know if you can tell, he has a urinary catheter in here. This is when he had an obstruction, and his kidney values were not really compatible with life at this point, but he's still eating because he's a cat, and that's what they do. The emotional changes, what we found is that this is kind of a more reliable way of looking at animals and looking for pain. And this is, again, you're the heartbeat of this. You know them. You'll see it first. We won't see that, and we don't really recognize it. So unless we have a real relationship with these animals, but you're going to see it at home first, even if it is seen somewhere else. Increased anxiety. If, you know, your dog never had anxiety and now he's anxious all the time, it could be pain. Increased aggression with people or other animals. And I'm going to tell you a life-changing story from me about intercat aggression. Some animals become clingy. They won't leave your side all of a sudden, or antisocial. He isn't following me around like he normally does. Their energy levels may go down. They could have relationship problems with, again, people, their best friend that lives down the street, or siblings. And some people think they're just slowing down, and that could be an emotional change that goes along with pain. So this is a story I was alluding to. This is George and Waffles. George was a cat I bottle fed. I had a litter of kittens that I bottle fed. He's a brown tabby. And you can kind of tell from that second picture, he's about 1/3 the size of Waffles, much smaller than Waffles. And I bottle fed him and I raised him, and he was always kind of my problem child. He had issues and some behavioral issues. He liked to urinate inappropriately in really horrible places. But you know, that was George. That was how he was George, and it was part of his, I guess, personality. And then Waffles was the large gray cat that showed up in my backyard, became friendly. He moved inside, and I had several cats inside. George lived with cats his whole life and dogs. And he always tolerated everybody. And for some reason, when I brought Waffles in, he hated Waffles and wanted to kill him from the minute I brought him in. And I tried everything, you know, drugs, introductions, all the things that we recommend to try. I tried everything. And I was actually contemplating finding Waffles a home because it was unfair. George was really kind of going after him and attacking him, and Waffles was terrified. It got to the point where I put a collar with a bell on George, so at least Waffles could hear him coming. At that time, George had shown some urinary issues, like I had described, and he then had a urinary blockage, which is an emergency, and quite painful. He couldn't urinate. So I brought him to the hospital, and we then did a surgery called a PU, we call it, a periurethrostomy, and it's where cats build up grit and sand and different irritants in their bladder, and they get caught coming out, and they can't void and urinate normally, and it kind of obstructs, and then they can't urinate, and it's an emergency. So what we do is we actually remove the end of the penis and make a larger opening for them, so if they still build up that grit, they can at least get it out. It sounds kind of awful, but it was a saving grace for George, and actually wound up being saving grace for Waffles as well. So the minute I brought George home from surgery from the hospital, he still had a very large incision, and I assume was quite painful. He was on good pain meds. But the minute I brought him home, him and Waffles immediately bonded and never left each other's side until the day that Waffles died. Well, they're both gone now, but Waffles passed first. And that, for me, was one of the most significant and profound lessons I've learned in my 30 years of veterinary medicine, which George really owed me because he was a problem child and a very expensive cat. But what that showed me, and what I've since come to realize is George was in pain. He had urinary pain. He had pain in his bladder and his urethra. And he had very few ways of telling me, so he took it out on Waffles. And when I think about it, as he was younger and older, whenever he had GI disease too, and diabetes. And anytime he'd have a flare up of his GI disease, he'd kind of snap at the other cats, as sometimes I do when I have pain as well. So that was George's way of showing me pain, and he was taking it out on Waffles. And the minute I got him home from the hospital, that pain was gone, and he felt better. So he didn't want to kill Waffles anymore. So I tell that story all the time because I learned so much from it. And who says you can't learn from a cat? These two cats taught me an immense lesson. And now anytime I see inter-cat aggression, that's one of my thoughts is, could it be pain? And in this case, it was, and it was profound. So some physical changes that we can see in cats, as well as emotional or vocal, cats that weren't vocal before. Litter pan avoidance. Again, they're not spiteful. They're trying to tell us something. It could be a urinary problem, but it also could be an osteoarthritis problem. Some people have multi-layer houses with several floors and the litter pan's in the basement. If a cat has joint disease and it hurts going up and down steps, they are going to be reluctant to go down in the basement. So they won't use the steps. Reluctant to jump, cats that aren't jumping. The other thing that we don't talk a lot about is over-grooming or licking an area. Dogs too, if they're constantly licking an area, it could be allergies or itching, or cats can kind of get a stress-induced over-grooming, but it could also be pain. and we need to address it as well. Decreased appetite or weight loss, or decreased activity, which can lead to weight gain, lethargy, changes in their walk, but again, that's not really seen so much in a cat, and changes in their positioning or stance, the bread loaf position, as we all like to call it. It could just be how your cat's sitting, but it also can be a sign of abdominal pain in a cat, so something to think about. I always tell my sister when she calls about her cat, I say, pet her belly, see if she minds. She'll let you know. Cats, again, harder to detect, harder to treat. They sleep about 23 hours a day, so we have a very short window there to detect that pain. Some of them go for walks. This is Ernie. He likes to go for a walk, but most cats don't. So you're not really watching them walk, jumping in the car. They'll eat in groups or ad lib, so they don't scarf down their food like a dog, some. Less responsive to our coming and going. So that's another cue. Your dog isn't at the door when you come home, something's wrong. Your cat isn't at the door when you come home, he probably just isn't hungry, at least in my case. Cats, again, aren't often lame. For treatment, we have fewer options. None of us can get meds into our cats a lot of the time. Sometimes we can. Exercise is harder with cats, but it's possible. And weight loss can be harder as well, especially if you have a multi-cat household. Physical changes in dogs, they're slower to sit or rise, changes in their gait or how they walk, if they're lagging behind on walks, and that's not something they did in the past. Lethargic, reluctant to go upstairs or jump up or down, and also decreased appetite, which will lead to weight loss, or decreased activity, which leads to weight gain. Changes in urination, like leaking urine or urinary tract infection or positioning. Now, this one is kind of weird because you think, what does urine have to do with osteoarthritis? But if you think about a female or male dog and how they posture to urinate, a female dog, especially with severe hip pain, is going to have trouble getting into and staying into that position. So sometimes they won't empty their bladder. They will just kind of take off the top of it. And that urine sitting in there can cause a urinary tract infection, or it can cause them to leak urine sometimes when they sleep. It could also be incontinence, but important to evaluate them for osteoarthritis as well. And changes in bowel movements. This is another one. I always thought my old dog was kind of just making me bend down and pick up several different piles. Again, stubborn spite, which he did not have. He had hip pain, and staying in that position to defecate was uncomfortable. So he would actually walk while he defecated because he couldn't stand in that position. So these are all kind of these subtle things that we, need to look for in them that we would never identify in a veterinary setting. So now what? Talk to your vet. If you think your pet has osteoarthritis or showing any of these signs, talk to your vet. Even better, talk to the techs. I can tell you as a vet tech, and I've been a vet tech for a long time, we love to educate you. Hopefully we have time, but if we don't, we will always direct you to a good resource. Really open the conversation, develop relationships with them, and that will really kind of open things up for you to feel comfortable talking to them. And that's why I recommend talking to techs. Sometimes, people are either intimidated by the vet or think the vet doesn't have time. They do, but you also want to talk to the techs. They're your friends. Bring a video. Always bring a video. Consider a checklist. They have several online, or you can ask your vet which one they prefer and which one they use, or a questionnaire. There is one made by Zoetis that I think is easy to use. For cats, there's the FMPI. There's actually a link on the CC website that'll bring you to a whole website about cats and osteoarthritis. So that's really, really a great resource for any cat owner. It's an online questionnaire that you can fill out from the comfort of your home with your cat on your lap, which is my favorite way to fill out anything. And the typical plan will usually start with some environmental changes, as well as analgesia, exercise, and weight loss. It's kind of that three-prong attempt at kind of getting it from all ends. You want to make sure you relieve the pain so you can get them moving and get that weight off of them. And then follow-up is really important. Is our treatment working? 6 months later, is it still working? Remember, this is lifelong treatment that these guys are going to need. Some really easy environmental changes you can make for cats is making sure they have good access to their litter pans. A litter pan on each level. These flat, if you see this picture, these flat kind of under the bed boxes for shoes are really great for cats that have trouble stepping up into higher litter pans, and maybe for the cat that's urinating next to the litter pan, that might be why, because getting in is harder for them, and these are a lot cheaper than marketed litter pans as well. And putting them in different places so they don't have to have them all in one place and potentially have inter-cat conflict over the litter pan, keeping them low. The other thing is we see weight loss in these cats because a lot of us keep the cat food up high so the dog can't get to it. And if the cat is having trouble, getting up or jumping up, that's a pretty high jump for those cats. They will not be eating as much. They just can't get up there. So by just providing them with some steps to get up there, that can certainly help, or if you can, keep it low. Padding and, nice padded beds, and cats, they love heat. They make some really nice heated beds, or you can put a low heating pad in there. Environmental for dogs, ramps and steps for them to kind of get up into the car so they don't have to jump up into the car or their favorite spot, some throw rugs, taking care of their feet and their nails and padding. This is my dog, and he has some neck pain, so I elevate his food so he doesn't have to bend down so much. So other resources, your vet is going to be your best resource. They know your pet. They know you. They can actually do physical exams. So use them. That's why they're there. Develop a relationship. And P.S., they're always hungry there. So if you bring some food, they'll be forever in your debt. And ask them for what resources they use. Assisi Animal Health, obviously, you guys know about that website. They have that really great the cat evaluation on there, and really great webinars, webbies, and YouTube videos. AHA, the American Animal Hospital Association, has some pain guidelines as well. IVAPM, the International Veterinary Association of Pain Management.org. That's where you'll find certified pain practitioners, veterinary practitioners. And I am an AAFP, American Association of Feline Practitioners. They have a cat-friendly home site for pet owners,